eOrganic proudly presents its Organic Dairy video series. The information in the series is brought to you by University of Vermont Extension and eOrganic, with funding from the USDA Organic Agriculture Research and Extension Initiative. eOrganic is eXtension's organic agriculture community of practice, providing certified organic agriculture information to farmers, educators, certifiers, and other agricultural professionals throughout the United States. For more information, visit us at extension.org/organic_production.
My name is Hue Karreman. I'm a veterinarian in Lancaster, Pennsylvania, and today we are here at Vermont Technical College with the herdsman Andy Wood and our Holstein cow alimony. And what I plan to show you is how to do a physical exam. And a little about me, but mainly is that I work with organic dairy herds in Lancaster area, Pennsylvania, plus all around the United States, and consult to other people in other countries as well. And one thing I would want to say is that a physical exam on a cow is the same whether she's organic or conventional. So this is fine for everybody who's looking at this. Doesn't matter how you farm, but I'm going to show you how I, as a veterinarian, look at cows and examine them. What we just heard from Andy is that she's a healthy girl and she does look good. She has a nice shine on her, okay, and it's winter time, and normally cows will be shiniest when they're out on pasture in the summer, and that's probably due to some of the compounds in the pasture that they're eating. But in the wintertime, when they have a little sheen here, I don't know if you can pick that up, but that's really good. Instead of just a dry, long hair cow, I like to see a shiny cow. That's the first thing I look at. Generally, you can see her ears twitching, and not twitching, but moving. You can see one ear up, one ear forward. One ear is forward with attention towards what's happening in front here. And the other one will come back when I'm talking at a certain point, and she's trying to pick up, they're like little antennas kind of. And you can tell by their ears where they're kind of listening to by the direction of the ears. So we have a machine in the background going, and this ear is picking that up, yet this one's keeping attention here, and that's good. That's a normal cow. If her ears were down, that's really bad. All right, ears being down on a cow is terrible. That means they are not happy, they're not feeling well, they're sick. And cows hate having their ears messed with, but certain times, especially with younger animals, they can have an ear infection. And in an ear infection, you'll see one ear droop down compared to the other one. All right, and if you see that, especially in a calf, you know, you want to get a little sniff of the ear if she'll let you. And it should simply smell like the fur of a cow. If you bring a cow's nose up towards the roof, it will roll her eye down the opposite way. You can see the whites of her eyes really good this way, okay? And that's a normal white of the eye up top above her pupil, okay? If you hold the head like this. And you can see those tiny little red venules in the top, and that's normal, okay? But if they're throbbing or thickened, that can be a sign of a toxic cow, a sick cow. The pupils, it's kind of the blue in the center of that brown there, should be like a rectangular box. And that's very difficult to catch, but it is contracting. And now it's a slit, just a blue slit, and if I take it away, that's going to enlarge to a rectangle again. One thing with the pupils there is that the muscles in the eye are dependent upon good muscle tone, just like the cow standing up, just like her digestive system has to have good muscle tone, and that's highly dependent on calcium especially. And so when a cow would be down with, it's just fresh, or just standing, and has very slow contraction of that pupil that we were just looking at, it could be a sign of low calcium. We want to look at also the drainage here. There's a little bit of drainage here from her eyes. Nothing terrible, but sometimes they get, kind of gunky, snotty eyes. And that would be a sign you want to consider, you know, there's something going on. Usually it's kind of connected with the nasal area and a cold or something like that. If you look at her nose, it's nice and moist. See that nice, moist, shiny nose? That's a good nose for a cow. That's good moisture, and you don't want it dry. Okay, a dry cow nose is just like a dry dog nose. You want a nice wet nose. You should be able to use your sense of smell and smell her breath. And it should smell, if you're around cows, like normal breath, or maybe even like rumen, kind of a little bit of rumen type scent to it. So you want to smell each nostril, because if you smell a foul scent, kind of like a hospital incubation plate smell, there could be an infection going on in the respiratory tract somewhere. But and both, and on the nose, it should be equal exhaling out of each nostril, no blockages or anything like that. Now she has a pretty black nose, but you can look in there sometimes. With her, it's going to be a little hard, but you know, it should be moist and glistening just like the outside. When they're drenching a cow, the head should be just about parallel with the ground and the mouth a little bit open. When drenching a cow, the nose should be about like here. She's tied a little tight, but never, never nose to the sky. Never. Because when your nose is up, it's very much easier to get it in the windpipe. When you stand behind a cow, your left is her left. So when someone says, give something from the left side, your left is her left when you're standing behind a cow. Your right is her right. So on the left side of the cow is her rumen, and the rumen occupies about this much of the abdomen, at least on the surface here, and then it goes all the way towards the midline inside and around. It holds, I don't know, 35 or 50 gallons of rumen contents at any time. And the rumen, you can listen to it best behind the last large rib here and below these short ribs. You can listen right here, below the short ribs, behind the last rib, and a rumen, you can feel the contents of the rumen and how fibrous or not fibrous the diet is, fiber meaning hay, and that versus grain, by pushing in here. And it should feel kind of, as it said, doughy up top here, because this is where the fiber raft sits. Okay, and the fiber raft is very important in the cow's rumen, because cows are herbivores and they're meant to eat only plant materials. And so you want to feel some resistance there, really kind of good resistance, and not just real easy in and out kind of thing. And this is where I'm going to lay the stethoscope as well, and I'm going to listen for a rumen contraction. And the way you do that, lay it here, and every minute to minute and a half, or I should say minute and a half to 2 minutes, but minute and a half on average, you should hear basically, as I am right now, a thunderstorm happening really close to your stethoscope. Okay, and the way the contraction, that's a contraction of the rumen, and you'll hear a thunderstorm in the distance when that contraction is starting, coming towards you and kind of happening, the thunderstorm, and then moving away. And you can actually hear it if you just put your ear on the cow. So the heart rate of a cow is generally just like ours, about 72. All right. With someone like myself who doesn't, the cow doesn't know me too well, she's a little bit stressed, it might go up to 80, something like that. So I'm going to listen to her heart. She's just been fed some hay, and she likes that. It's very nice looking hay, and she's enjoying that. And I'm going to bring the stethoscope kind of behind this shoulder blade area, upper leg muscle, and listen. And I'm listening to the heart. You can't hear that, of course, but this is where we listen to it. And it should be very easy to hear. It should not be muffled. And I usually look at a watch, if I'm wearing a watch, and just go for about 15 to 30 seconds and figure out what her heart rate is. So that's where you listen to the heart. The lungs on the cow are generally in this area here. A lot of them are shielded by the shoulder blade right here, but they come back a little to here and through here. So I'm going to listen to the lungs here. This is where I can with the stethoscope. And the lungs, I'm going to listen up here. And cows will take about 24 plus minus breaths per minute. And if they're eating like she is, and I'm glad she is, that means she's content right now and happier than not having that. These lungs should sound like a bellows. Like if you have a bellows and you're kind of pumping air into a fire, just a. And so this is the area for testing, for listening to the lungs. If I hear a real rough sandpaper sound up here, sometimes it'll mean that they have a viral infection, a viral respiratory infection that's starting. Okay, and usually there's a high temperature with that, associated with that. When we get the more serious respiratory problems are when the secondary bacteria invade down here, and we get a secondary bacterial invasion, and them being heavier than viruses, the bacteria, they tend to be down in this area. And then you'll hear rougher sounds here. Sometimes, unfortunately, she's a happy, healthy cow, but you'll hear with the stethoscope right up, and you do it on the same side, same area on the other side, way up front underneath, you'll hear windpipe sounds, just essentially only the sound that's coming through her trachea, and her trachea is on her right side over here of the bottom of her, or on the right side of her neck over here. The esophagus or is right here, and that's what the hay is going down right now. So sometimes though with lungs that are a problem, you'll hear just the windpipe sounds, and that's not good. So the heart we listen to in here, the lungs are right up in here that we can hear. The rumen is all right in here. And sometimes you'll see bloat on a cow where, again, your left is her left. This left side will be bloated out. Okay, and that's where the bloat is. It's a rumen gas cap over that fiber. All right. Now, if you have a fresh cow, there's a condition called twisted stomach or a displaced abomasum. And you can listen for that with a stethoscope. If she's off feed, fresh 10 to 14 days, you can listen to her rumen, make sure that's functioning every minute and a half or so, turning over like a thunderstorm like it just did. Listen to her heart, listen to lungs, and then you're going to place the stethoscope over these large ribs here, put it on the rib, or I'm sorry, between the ribs, and you're going to flick the ribs real hard with your fingers. And this is testing for a twisted stomach, and if she were to have a twisted stomach, she would have a sound of basically like a tin can bouncing down an alley, ping, 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 or chimes, or basketball sounds. You know what they sound like, Andy? Yeah. Hopefully not too often. But it's unmistakable. And what that is, a twisted stomach, is not the rumen. The rumen's the second stomach. The twisted stomach is the abomasum, which usually lays on the floor of the cow, becoming like a balloon, and it has to go up because it's got air in it, which it shouldn't. Then it'll come up right behind these ribs here, and as I said, the rumen's here, but it comes up right between the ribs and the rumen, so it gets really tight. And that's why you can hear that high ping, 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 ping when you're flicking. You can hear this with the flicking. That's how hard it should be to hear that, okay? The trachea, the windpipe, is on the right-hand side. So that's an important thing, because if you're going to pass a tube down a cow's throat into the rumen, which is on the left side, you always want to make sure that when you bring the tube in, that Stay left of center. Swallow has 2 L's in it. Stay left of center to pass a tube, because then it goes down the esophagus. On the right side's the windpipe, the trachea. Here's the jugular vein. You can see it extended here, bringing blood back from the head to the heart. It's on both sides of the neck. There it is. You can see it when I push here, it stops the blood. You can see a little pulse up here. And it'll fill up when I hold it off. And you can see it right here. And it runs the length of the jaw back down to the brisket. There, you can see it filling up there. When I do that, it backs up because the blood's going this way. If I'm going to IV a cow, give an intravenous fluid, I'm going to want to have her head down because it fills up the jugular vein generally better. Okay, and I'm not going to want to be too close to her jaw because there's a lot of vessels here, the arteries and whatnot, and you don't want to be too much back here. But right about mid area of that neck is where you want to put in a needle for an IV fluid. And you want to have the head tied up real good so she's not freely moving her head, of course. Here's a 14 gauge by 2-inch needle commonly used for intravenous administration of fluids on adult cows. Here's a 16 by 1-inch needle commonly used for intravenous administration of fluids on calves, baby calves. Here's an 18 by 1.5-inch needle commonly used for intramuscular shots or under the skin shots for any animal, mainly cows. And here's a 20 by 1-inch gauge needle. They get thinner as we get higher numbers. So this is fairly thin compared to that 14 gauge. And I use this on calves or goats or sheep, and especially horses. There, that's the 14 by 2-inch IV needle. Okay, and we're going to use this size needle to give an IV to a cow. And here I have an IV line. I just happen to have my IV line on me without a bottle. And these IV lines I really like a lot, because these particular ones, I don't know if you have these, Andy, these clear with blue versus the tan ones. The old-fashioned tan ones have a very floppy top. These tend to be rigid in cold weather, but that's okay. And the tan ones you can't see through too well, but you can see the white through there and the black through there on the cow. And that's very handy to know if you're in the vein or not, because what we would do with this cow is we would use the IV needle, and I take an IV needle and I hold it like this. I hold it by the hub, and then with her head tied and with the jugular vein prominently showing, I would stab her real hard with the heel of my hand, essentially stopping the needle, or allowing the needle in, but kind of stabilizing that needle until I would get the IV line attached. The height of the bottle, when the needle's in the cow, now her head is going to be strapped to something so she's not moving around. I hold it this high, and this is a bottle of calcium borogluconate 23%. And obviously it was used, hopefully the cow got up, but this is the height. And if you hold it higher, it goes in faster. And that you don't want to do with calcium, because you can kill a cow by causing heart block with the calcium going in too fast. You can hold a bottle of anything up here you want other than calcium. It can be dextrose, hypertonic saline, vitamin C, lactated ringer solution, as high as you want. But calcium, no higher than the backbone, whether they're standing or laying down. All right? And if you lower the bottle lower than the point of needle insertion, blood should come back in the line, which lets you know that you're still in the vein in case she moved around a little or whatnot. A sign of a cow being somewhat low in calcium. She's standing, she's fresh, she's a little slow, there'll be little muscle twitches you'll see along the shoulders, and also back here at the leg, and maybe here. And they'll have cold ears, and they might have a very mild bloat. And that's a subclinical low calcium, because the muscles that move the skin and everything are affected. Okay? Okay, so here we're looking for ketones from the urine. That's the easiest and most effective way. Okay, and we're waiting. You got to wait 2 minutes for this, but if a cow is ketotic, this little pad is going to turn purple, as most people know. But the ketones would mean that she's in needing energy in the bloodstream. She's low blood sugar, and then the liver can convert fat to usable energy called ketones. And but it also tells you the animal is not taking in enough energy for whatever reason. Okay, so now we're on the right side of the cow. Again, we have the short ribs, we got the big major ribs, and the abomasum, or the true stomach like monogastrics have in people, sits underneath here a little right of center. This is where the fourth stomach sits, the abomasum. And the omasum, the third stomach, sits in this area here, but in. And that's fed from in the rumen and the reticulum up front on the other side. Up here, we have all the intestines, okay? And this is where all the food is absorbed, all the nutritional absorption from either the microbes in the rumen, going downstream when they die, they get absorbed, all their proteins and everything, and also other nutrients like minerals and all. Magnesium is absorbed across the rumen wall, but other minerals are absorbed in the small intestine here. It is normal to hear a ping like we heard over on this side, on the left side, we heard where we tested for pings for a twisted stomach. If you hear a ping in this area, I would not be alarmed at all, okay? A cow milking 100 pounds or a good amount of milk can have a ping here, and that's the spiral colon, the gas in the spiral colon moving by. And usually you'll hear a kind of a ping, 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 right here when you're doing that. Well, you don't even have to flick it. You just sit and you'll hear gas moving through the gut normally. If a cow is off feed and you've listened to the left-hand side and the rumen's not moving, or it's sounding very smooth like the ocean hitting the beach and not a thunderstorm like it should, and you don't hear a ping there, and she's completely off feed and she doesn't look happy at all, then you want to go to the right side as well and ping on the right. And you shouldn't hear anything in a normal cow except just thuds when you're pinging them in this whole area. If you hear a high-pitched ping in this area, and the ping even comes down into this area, real high ping, 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 you're going to think of a right-sided twisted stomach. And those need surgery that day, okay? On the right side of a cow, if she were to be pregnant 6.5 months or more, you can push in here in what we call bumping a calf, where you push in here and you'll feel the actual calf body part, some bony part right in there if you're kind of going back and forth. And you'll feel that at about 6.5 months or more of gestation. It's kind of a nice double check for farmers. You know, the vet called the cow pregnant at 45 days. You didn't think about her at all. You want to make sure she's still pregnant when you dry her off and she has her little 2-month vacation from milking. You can just go like this a little, and most likely you'll feel the calf bumping up against your hand on the other side if it's 6.5 months or 7 or 7.5 months or more pregnant. And you see how the cow is sometimes shifting her weight a little bit. It is milking time here. She may be feeling a little like she wants to get milked. I wouldn't be surprised. But if a cow is off feed and she's treading a little, we call this treading, just shifting her weight on the back legs, that's a colicky sign in a cow, and that's not good. Cows, unlike horses, cows cannot roll like a horse rolls when they have colic. So they show this movement, just like you're seeing here, just kind of shifting her weight off her back feet, okay? Okay, so now we're going to take the temperature of this cow. Normal cow temperature is in a range that I've always thought to be, and well it is, 100.5 to 102.5 Fahrenheit. Anything above 102.5 Fahrenheit is a fever. Now if it's a hot day outside, they're going to all run hot, but if one animal out of them is higher than the rest, you know, it's a fever. So 100.5 to 102.5. And what we normally do is we will lubricate the thermometer and put it in rectally here, which I'm about to do. But if the cow has diarrhea and and she's sucking air in and has diarrhea and sucking air in, you don't want to take the temperature rectally. You want to take it in the vulva. And that's because that'll give you a real reading, whereas if you take it in the rectum when they have scours or diarrhea, it's going to be false low. So I'm just going to wet this a little. And you always want to make sure it's shaken down because it's sitting at 102.2. And I shake it down, and if you like the digital thermometers, that's fine, but they're very sensitive to getting wet. So now I'm going to lift her tail, and I'm going to just hold it in there a little. And we can, I usually leave it in about a minute. Pull up on the skin above the shoulder blades, and this is a test for hardware disease. A cow that has hardware disease, or a piece of metal in her first stomach, the reticulum, which is over on this side, will not drop her back, because it's painful to do that, if I lift her skin off her back here at what's the withers. So I'm going to go like this, and you're going to see her back most likely curved like that. See? All right. Now, actually, some cows with hardware will do that anyway, but then they won't do it 2 times in a row. She shouldn't, if she had hardware disease, she won't do this a second time. And she does do it a second time, so, she wouldn't have hardware disease if that's what we thought was happening, generally. Okay, we're going to see what her temperature is, and it is 101.8, totally normal, 101.8, and sometimes you have to move these mercury type thermometers around a little, just a little. Okay, with a cow, anytime, you're going to see me put my hand on her tail, and you're going to notice that the tail kind of goes towards her body just reflexively. See that? So do that first with a cow. Let her do that. Just don't come up to a cow and just take her tail and lift it up. Just let her reflexively say, hey, I'm guarding myself a little bit. And then take the tail up and then reach in. And then I flip it over. And of course now I'm going to be, you can't really see what I'm doing, but I'm going to be reaching in, and this is when we reach in and feel for the uterus to see how it's going along. And she has what we call a good tone, kind of maybe coming near heat. I think I feel a follicle on the left. I don't know when she was checked last, just early on.
Yeah, just early.
You can see the clear mucus right here. She's in heat right now with this clear mucus, okay? So I thought she wasn't near heat, and she's actually in heat, okay? Now, a farm that has a lot of cows that show a heat at 45, 50 days and not again then until like 120, 130 days fresh, might want to consider breeding cows sooner than the voluntary waiting period of 60 days. So, some farms will breed her then now, but she won't peak as high in milk, and also, but you'll get her bred back. That's especially true with first calf heifers. So I'm feeling the kidneys now. I'm up to my shoulders, not my shoulders, my muscles, biceps here, and I'm feeling the kidneys. They should feel like a patchwork, quilt work type thing. I feel the rumen inside here. It's very firm, actually, so you're getting a fair amount of effective fiber into her. And then, like I said, she's in heat. When I'm reaching inside here, I can feel for internal lymph nodes and various other things that you only know about after reaching in cows a lot. And the other thing is sometimes I'll just, I felt some undigested corn in here, but there's not too much there. But sometimes if you have manure that's more firm and you take it out and you squeeze it, and you get liquid droplets coming out and firm manure up top, that can be a sign of poor digestion and also hardware if they've all of a sudden gone off feed. So now we've looked at the cow from the head, through the throat, both sides of the abdomen, the lungs, the heart. We reached into the abdomen as we could rectally. Another thing we can still look at visually before we get to the udder is the hooves. And the hooves on cows, maybe more in tie stall situations, are usually pretty easy to be seen as far as any kind of irregularities. And what I'm trying to get at is that the hoof grows down from the hoof hairline junction, and if there's any kind of stress on a cow, she will show a growth line, or a stress line it's called. And so if you look on a cow, on all 4 hooves, you might see a line halfway down the hoof. And you know that some major stress happened. And it takes about 5 to 7 months for a hoof to grow down to the ground, regenerate itself. So it's just something to look at. And usually the whole herd has it if you can see the hooves real well. Just something to take note of. All right, so now we're going to come to the udder, and she's really full of milk. And we're going to wash off the teats, because what we want to do is we want to check her milk quality. And then once we do that, we're going to let our friend Alimony go to the milking parlor with her friends out there, because she's really going to start dripping milk here in about 30 to 60 seconds, because that's the reflex time from this tactile touch. If you're having trouble with a cow letting her milk down, you really want to vigorously do this, kind of like as a calf would be bumping up against the udder, because it's a tactile stimuli by touch that gets them to let the milk down. Now, they all look nice and clean, I think. But what's more important, most important, is right there at the teat end. The teat is the teat sphincter is a little bit everted here, coming out, meaning it's a little prolapsed, and that will gather dirt easier. So I'm just going to look at each of the 4 teats and make sure they're clean, because that's the entryway for environmental bacteria to get into the udder. And if you see this little white ring here, okay, that means this cow has been either the machine is on her too long, or there's a fluctuation in vacuum, too great of a fluctuation during the milking time. And this one is a little bit extruded as well. Not extruded, but kind of coming out, and they shouldn't be at all. All 4 teats are like that. You can see that right here, a little white ring by my index finger, and it's a little harder on the black teat. We're going to check her milk quality by the California mastitis test, which takes this paddle here, and even though these letters are here, A, B, C, D, I never can keep track which quarter is which, so I just hold the plate like this with the handle the same direction as the tail. All right, so now I know this will always be right front, left hind with that here, even if I'm out here. That's the tail of the cow, well, that's right hind. Okay, so now I'm going to just strip out some milk into each of these plates. And I'm going to take an equal volume of this CMT, California mastitis fluid, an equal volume. You getting this? And then we're going to shake this around, and we're going to look for any kind of thickening or gelling of this fluid in here. And I don't see any, but if there was, I would take note. And and this is normal milk, this is great. And then we're going to show this and watch the drips coming off, and the drips are all like raindrops, and that's good. There's no gloppiness to it. Okay? So she has a good CMT, so her milk is totally normal, and she's a healthy cow, and we should let Alimony go be with her friends.